It's catching two pathways. Now, Advair, Dulera, and Symbicort all came from the asthma community. Brio has only been FDA approved in COPD.
Really?
Yep, cannot be used in asthma. Some of that's because we've learned that, or studies have been showing us, we're looking more and more at asthma, that maybe people don't need the long-acting albuterol in asthma because there has been, if you ever see on any of these, even though you get a black box warning, it talks about may cause worsening asthma or asthma attacks. It's because of the long-acting albuterol that's in it. And so the first line treatment for asthma now is just to use an inhaled steroid and add on the long-acting albuterol at a later point. So therefore, all the drug companies now are moving away from that for asthma and moving into COPD. But the steroid part of COPD, we're not so sure necessarily that everybody needs that in COPD. So when we talk to the as we talk about some of these other drugs, you'll see that the steroid's not there. Yeah, so maybe it's the opposite. Maybe we need to put, some of the GOLD guidelines are saying, let's do the long-acting albuterol first, and then we can add the steroid on later if we need it. So kind of the opposite of asthma. So this is really, really easy to use. You just move this down, it clicks, and then you just inhale off of it, and you're done. But it has a steroid in it, so you need to make sure you rinse your mouth out, just like you would with Symbicort, Dulera, and Advair.
Is that twice a day also?
Twice a day.
Twice a day.
No, excuse me, once a day. Brio is once a day.
Advair's twice.
Yep.
Oh.
Dulera, Advair, and Symbicort are all twice a day. The Breo Ellipta is once a day.
So have you had any patients that switched from Advair to that?
I have two. One's reported back.
Okay.
And she really liked Brio better. And the other one I just switched recently, so we haven't done it. I haven't heard back.
Okay.
Do you like Brio?
Huge difference.
Really?
Enormous difference.
Oh, wow. What's different?
It's like I have my old life back.
Oh.
I have energy, I can breathe easier. This is a rainy day. Before Brio, I wouldn't be here. So I notice a huge difference.
Okay. And what were you on before the Brio?
Advair.
Yes, I just like Advair does nothing.
Now, I don't know if it's the steroid component or what, but, or just what I've been eating, but since I've been on it, I've put on 10 pounds.
Whoa.
Yeah.
It's the same steroid that's in Advair. Steroid's the same.
So, then we can't blame it on the drug,
Okay.
right?
Side effect of Brio, you eat too much.
I've been taking Advair
Yes.
well over 6-7 years,
Yes.
longer than that.
Both drugs.
And
cause
Bill and I were
me to
discussing before the meeting. It seems like, okay, you do your drugs, but what difference? You don't feel any up or down, and you still fat. Is there a point where you have built up a tolerance that this is not really
Right.
effective?
There have been no studies on that, but there have been some. No one's done a head-to-head comparison of all the different Dulera, Symbicort, and Advair. But some of the COPD studies are starting to push a little bit more towards Symbicort over Advair.
Point of interest, I just recently had an EFT test. Gone to my doctor and I haven't met yet for the results. I've also been on Advair for a long 5 years. Will this test, I was going to say they'll compare from when I was originally diagnosed and will they maybe make a suggestion?
Yes, they will. When you get your breathing test, your PFTs done, we always look back to what they were to see if there's been a progression. Right now insurance companies are making me move a lot of people off Advair. I have to say, I like Advair because I think it's easier to use than Symbicort and Dulera. You just open it up, click it back, take your one puff, rinse your mouth out, and you're done. A lot of people don't use the meter dose inhalers correctly, and we're Symbicort and Dulera back to doing the meter dose inhaler, which people screw up a lot and pick up bad habits and all that kind of thing. But insurance companies are really pushing Dulera and Symbicort before Advair. So a lot of people have had to move off Advair because of that. So my concern is, I don't know if insurance companies, how much they pay for Brio yet, because if they're saying they're not paying for Advair, and Brio's new device, new medicine, new thing on the market, I'm not sure how much insurance is gonna pay. Now, the one lady's reported back to me, I didn't have to do prior authorization or anything. Did
My
you?
insurance company pays.
So, I'm not sure what Brio came in with contract for, but apparently it's good.
And I'm Anthem,
Yeah,
which
huh.
probably a lot of people have,
Yes,
and no problem at all.
really?
And
Okay,
they paid the same amount as Advil.
really?
Yeah.
Okay, and those one wants giving me a hard time for Advair.
I think mine will pay too, as long as I get the letter. You know, I have Anthem too, and I'm certain they would pay for it with a letter.
Well, the letter has to say why you can't tolerate one of the others.
Yeah, exactly.
So you have to have something other than like, I didn't like it because it was written.
I don't think the Advair does any good. I mean, I've tried not taking it 2 or 3 weeks at a time, and has been no difference at all.
Maybe that's a good part of the year.
I don't know the difference.
Any questions on
I think
Brio?
it works.
I question
Okay,
it.
so the next one we'll talk about uses the same device. And it is Anora, it's also Ellipta.
One more question,
Oh,
right?
go ahead.
Okay, if you do Spiriva, you can also do the Brio?
Yes, because if you're doing Advair or Symbicort or Delera, which is Spiriva, same thing.
Okay,
Yep,
because I do
fine.
Spiriva and I do the Advair.
Yes. Yep, so this is just up to this for Advair.
I'm gonna get on the
Yeah.
So the gold guidelines are saying that we can combine both of them. The LABA, which is that long-acting bronchodilator, and the LAMA, which is Spiriva and Tudorza. Okay, so Anora, you see this is red and not blue. It is, okay, I'm going to try to pronounce this. Methylphenidimium and Lenterol. Okay, so this is a combination. Now this is Anora, not Brio, so skip the Brio piece. And this kind of answers your question. So this has a long-acting albuterol, and it has a Spiriva, a tiotropium, Spiriva, Tudorza drug. So it has a combination of 2 drugs. Now you notice there's no steroid in there. So this is combining that LABA and the LAMA together. And again, the COPD, do we have to have the steroid? That's the question. So now this is coming out combining essentially, if you're on 4-nil or you're on Ceravans, combining that together with a Spiriva or Tudorza once a day. So that's really nice because now you're combining, if you're someone that needs both those drugs, you're combining both into one, and it's only once a day, which is really nice. But again, I think you have to have a reason for your insurance company to say, yes, we will pay for one, although it's fewer co-payments, if that's the combination that works for you. So I think that's going to be really nice if insurance companies will pay for it. Once a day, and move on with life, and keep going for the day. Yes?
What would make somebody, like if I'm on Spiriva and Advair, and what would make me want to try that?
I think as we've kind of, COPD and asthma are both kind of evolving of, do we need the steroid and the long-acting albuterol? Are they both needed? And COPD, they've been debating that for a really long time. And there are definitely people with COPD that need the steroid. They need that anti-inflammatory because their airways are always inflamed. Now, are those people that also have some asthma, maybe, and not pure COPD? Or is there maybe people with COPD that have more of the junk and the congestion and stuff, maybe they need more steroid? We're not really sure. And so people can debate back and forth whether you need a steroid or not. So if you don't need a steroid, maybe you don't need Advair. But at first, that's what we were putting everybody on. Everybody was put on Advair, Symbicort, Delera. Everybody kind of got that, and then they got Spiriva on top of that. And now we have Tudorza on the market. But that's kind of where everybody went. So maybe, revisiting that, maybe you don't need to have that steroid. So maybe you can get away with just the long-acting albuterol, which we do think you need for COPD. And if we combine it with the Spiriva, we get this one. Yeah.
So you could ask for it just to see if it worked
Right.
better?
I think it's not a bad thing. I think this will become more popular, and I think we'll be using it more, but I think right now it's going to be the same thing with the insurance companies. We're going to have to say why this is a better option and why they need to pay for this.
Do your PFT results tell you as a practitioner whether you've got more COPD or more asthma, or whether you need the steroid?
Right, so her question is, when I look at your PFTs, does it tell me whether you have more COPD and more asthma? Yes. I definitely can see it on that. When you go and they yell at you to blow, you go blow, 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 and then sometimes you get a breathing treatment after, you have to inhale some albuterol, and they do it again. If you respond to the albuterol, and actually the number is by 12%, or your number increases by, as long as your number is increased by 200 mLs when you do it the second time, if those numbers are positive, you're above that 12% and 200, then you have an asthma component.
Right.
If they don't change, it's COPD. Russell?
About 2 years ago, Becky Alberti came and gave a talk, and that's on our website. On PFTs and how they do and so on.
Okay.
That'd be great.
Looking at.
Becky probably did a great job with that.
I think it was January, a year and a half, 2 years ago. Becky Alberti.
She's there, she's in our PFT lab at VCU, she's been there
Well,
a long
she's the
time.
best. I've had them all over.
She is really good. If anybody's in any of our clinical trials, our pulmonary clinical trials, you've met Becky because she's the person that does the PFTs.
If you take that, you would take the first one if you're doing something excessive.
Yeah, so if you're taking this, if you switch over to this or the Brio, the Respimat, the Combinent can still be used as your rescue. But again, people tend to not use the ipratropium so much with the long-acting ipratropium kind of, if you would. There has been a lot of studies on that. Although we put people on short-term albuterol when they're on long-acting albuterol. They use albuterol plus you use long-acting albuterol. So definitely if you ever went to the hospital, they put you on both.